Marijuana is the mixture of the dried and shredded leaves, stems, seeds, and flowers of the cannabis sativa plant. This mixture can be green, brown, or gray. A bunch of leaves seem harmless, right? But think again. Marijuana has a chemical in it called delta-9 tetrahydrocannabinol, better known as THC.
A lot of chemicals are found in marijuana. About 400 of them. Many of which could affect your health. But THC is the main psychoactive, mind-altering ingredient. In fact, marijuana's strength or potency is related to the amount of THC it contains. The amount of THC has been increasing since the 1970s. Estimates from confiscated marijuana indicated that it contains almost 10% THC on average.
Some slang terms for marijuana are pot, grass, herb, weed, Mary Jane, reefer, slunk, boom, gangster, kiff, chronic, and ganja.
Some people mistakenly believe that everybody's doing it and use that as an excuse to start using marijuana themselves. Well, they need to check the facts because that's just not true. According to NIDA's 2012 Monitoring the Future study, about 6.5% of 8th graders, 17.0% of 10th graders, and 22.9% of 12th graders have used marijuana in the months before the survey.
For some people, smoking marijuana makes them feel good. Within minutes of inhaling, a user begins to feel high or filled with pleasant sensations. THC triggers brain cells to release the chemical dopamine. Dopamine creates good feelings for a short time. That's just one effect.
Imagine this. You're in a ball game, playing left field, and a fly ball comes your way. When the ball lands in our glove, your team will win and you will be a hero. But you're a little off. The ball grazes your glove and lands in the dirt. So much for dreams of glory.
Some effects of marijuana are memory, judgment, perception, relationships with friends, and relationships with family.
THC is up to no good in the brain. THC finds brain cells or neurons with specific kinds of receptors, called cannabinoid receptors, and binds them together. Certain parts of the brain have high concentrations of cannabinoid receptors. These areas are the hippocampus, the cerebellum, and the basal ganglia, and the cerebral cortex. The functions that these brain areas control are the ones most affected by marijuana. THC interferes with learning and memory because of hippocampus, a part of the brain with a funny name and a big job. It plays a critical role in certain types of learning. Disrupting its normal functioning can lead to problems studying, learning new things, and recalling recent events. A recent study followed people from age 13 to 38 and found that those who used marijuana in their teens and continued has a drop in IQ even after they quit.
When people smoke marijuana for years, they can suffer some pretty negative consequences. For example, because marijuana affects brain function, your ability to do complex tasks could be compromised, as well as your pursuit of academic, athletic, or other life goals that require you to be 100% focused and aware. In fact, people who use marijuana over the long term report less life satisfaction, poorer education, and job achievement, and more interpersonal problems compared to people who do not use marijuana.
Studies show that early marijuana use may increase your risk of developing psychosis if you have a genetic vulnerability to the disease. Psychosis is a severe mental disorder in which there is a loss of contact with reality, including false ideas about what is happening, and seeing or hearing things that aren't there. Marijuana also has been associated with depression and anxiety.
Within a few minutes of inhaling marijuana smoke, an individual's heart beginning to beat more rapidly. The bronchial passages relax and become enlarged, and blood vessels in the eyes expand, making the eyes look red. The heart rate, normally 70 to 80 beats per minute, may increase by 20 to 50 beats per minute, or in some cases even double. This effect can be greater if other drugs are taken with marijuana.
Kids who abuse marijuana are at risk of injuring their lungs. Thought exposure to respiratory irritation found in marijuana smoke. The smoke from marijuana contains some of the same chemicals found in tobacco. Marijuana users inhale more deeply and hold their breath longer, So more smoke enters the lungs. People who smoke marijuana also have breathing problems. They are more likely to get chest colds, coughs, and bronchitis than people who don't smoke.
Many people don't think of marijuana as addictive. Well, they're wrong. About 9% of people who use marijuana become dependent on it. The number increases to about 1 in 6 among those who started using it at a young age and 25 to 50% among daily user.